Hi everyone, my name is Dr. Lauren Collins, and I'm here to talk to you today about visceral manipulation. Visceral manipulation is one of the many services that we offer at ThriveAgain Physical Therapy. So here's some info for you. So basically, visceral manipulation involves mobilizing the connective tissue that surrounds our organs. So viscera, meaning organs, is what we're working on, or that connective tissue. And so if you're not quite sure what fascia is or the connective tissue is, if you've ever eaten chicken or cleaned chicken, if you know how when you pull the skin back, you see that kind of shimmery sort of tissue there, that's fascia, that's connective tissue. And it surrounds our organs and our muscles and various structures in our bodies. And so visceral involves mobilizing that specific type of tissue with the organs. And so if we look here, on my little anatomy person here, you see different organs here like the intestines, and beneath this there's also the liver, and what else we have here? We have the liver, the lungs, all kinds of things in my little anatomy person here. And those are all the types of organs that we help to work with mobilizing the connective tissue. And so in visceral, what we first do is we do a listening, which involves first placing our hand on top of your head, and we feel where your body pulls to. So in visceral, we say your body hugs a lesion. So where there's a restriction, the tissues pull around it. So if you have a t-shirt on and you were to knot that t-shirt up, you would see how the other tissue in the t-shirt will pull towards that knot. Well, our connective tissue does the same thing, and that's essentially what we're listening for with our hands when we do a visceral listening. So the first one is with our hand on top of your head while you're in standing. And then the other one, the next listening, is more of a local listening where we're coming down your body, down your abdomen, your chest, or whatever part of your body in the midline, front or back. And we're feeling for where your body hugs, where it is. And then from there, we discern which organs we want to work on with some other kind of touches off to where the organs are so we can see where the body pulls to or away from. And so that's basically how we first figure out which organ we want to treat. Once we figure out which organ we want to treat, then we have to go ahead and treat. And so with visceral, it just involves stacking the layers of connective tissue up. So going in the various, mobilizing the connective tissue and the organs in the various directions that the fascia is made up of. And once we find where it's restricted and where it's not restricted, then we kind of mobilize into that. Not kind of, we do. And so hopefully from that, we get a good release into those connective tissues and free up and mobilize some of those restrictions that are going on in your organs. And from that, hopefully your symptoms, if it's pain or if it's maybe restrictions in your intestines, maybe you're having a hard time going to the bathroom, maybe it helps open that up so you can go to the bathroom a little bit easier. There are all kinds of reasons why visceral would be a good treatment because it helps with all of those things. Pain, restrictions, getting fluids to flow a little bit better where they're supposed to. So, in short, that's what it does. And I hope that answers some of your questions about what visceral manipulation is and what it does. If you have any other questions or you want to go ahead and schedule that service for us, go ahead and give us a call at ThriveAgain. All right. Hope you all have a great day.